For months, people have had to put critical medical procedures on hold during the pandemic, including transplants. With no end in sight to the crisis, the wait is getting longer. Here's Nikole Killion.
All right, good kick.
Nishant Menon is a single father of two.
Right.
He has been waiting for a kidney transplant for almost as long as his boys have been alive.
Good job.
Taking care of my children, working and keeping a paycheck coming in, and having to do all of the treatments and dialysis, all of that takes a lot of time.
So when Nishant got the news earlier this year that his transplant had been scheduled,
It was the happiest I've been in a long time.
but then coronavirus hit and his surgery was put on hold.
I had started to get very excited, and so having to resign myself to the idea that I was going to have to keep doing that, and I didn't really know how long, that was a little dismaying.
Amid the outbreak, organ transplants plummeted over 50% in the U.S.
The number of kidney transplants being performed, there was a very sharp reduction.
Dr. Niraj Desai is Nishant's physician.
Because of the concern of how this pandemic would affect both transplant recipients and could it potentially cause them to become very sick.
What will it mean to you when you're finally able to get this transplant?
I can kind of start my life again.
And what will it mean for your kids?
I feel like they'll get their dad back in terms of being like that dad who can actually like go out and play with them all the time and isn't tired. That'll really be exciting for me and probably for them.
Kicking off a new lease on life. Nikole Killion, CBS News, Springfield, Virginia.
What an emotional roller coaster for that family.